Good afternoon, and thank you for joining us for the December 8th COVID-19 virtual news conference. My name is Christine Messenger, and I am one of the public information officers for the COVID-19 Joint Information Center. Today, we're joined by Humboldt County Public Health Director Sophia Pereira and Humboldt County Health Officer Dr. Ian Hoffman. Sophia, can you provide us with a few opening comments?
Yeah, absolutely. Good afternoon, everyone. Just really quickly, I wanted to just touch on our presser schedule, given that we're in the holiday season. So we did at our last presser talk about how we are aiming to have pressers at least twice a month. And so actually for this month, we're having 3 in a row. So we had our first one for December last week. We have this one today, and then we'll have one on the 15th. We will be dark December 22nd and the 29th. And then from there on out, we should be resuming the every other week flow of this. And we will be continuing our daily reporting as we do, except for any county holidays that we have coming up. And we'll definitely make sure to let you all know when those are happening. And that is it for me. I look forward to your questions.
Thank you, Sophia. Dr. Hoffman, can you please share some updates?
Sure. Thanks everyone for being here today. Yeah, not a ton to update on since last week. I think just to recap from the Omicron perspective, we're seeing, that it's certainly a question of when, not if, it reaches our county. No evidence yet that it is here, although there is increasing evidence in California and likely across the country that this is here and circulating in some communities. So we're continuing to do what we can to try to identify it as soon as possible through whole genome sequencing, enhanced screening of travelers, working with our medical community to get more travel history from folks who've been traveling internationally recently. And then also just continue to watch the spread of this across the state of California. If there are any updates from the state health officials, definitely we'll relay those to you as well. As far as this variant's ability to spread faster, I think the data is continuing to come in that it does spread faster than previous variants. And so there's becoming more and more certainty of that question. The question around whether or not it's more severe or less severe is definitely still one that's up in the air. And so definitely want to, take caution, be cautiously optimistic on the reports of the fact that it might be less severe. While we hope that is the case, there's still not enough data to say for certain that that is the case. So we're watching that very closely, as well as data around the effectiveness of vaccine immunity, as well as previous infection and immunity from an infection, and how that will interact with this new variant. Our vaccination progress is definitely going better. I think there's been an increase in vaccinations since the announcement of the Omicron variant, along with an increase from opening up to the 5 to 11-year-olds. So we're happy that people are going out and get their vaccine, and I think that definitely this is still by far the best thing you can do to protect yourself against all the variants of COVID-19. Especially the one that we know is here and circulating right now and should be the focus of all of our attention, which is the Delta variant. We know that the vaccines work really well against it, and that that's the one that we have circulating in our community. So please get vaccinated. Please get a booster if you're over 18 and are fully vaccinated. And lastly, I'll just say, hospitalizations are really the metric that we're watching. As we go forward in this, I think, that's what is going to be the most important metric. We've, really hit kind of a all too high floor with our hospitalizations. It continues to be, that we have hospitalizations around 10 to 15 per day in the hospitals. Those are people who, while we might not have new admissions every single day, many of them stay in the hospital for as long as 3 to 6 weeks. So those COVID admissions create a lot of pressure on our local hospitals. And today we are actually up to 19 hospital admissions across the county. So it's something that I think going forward is going to be the most important thing to watch, and certainly what we're watching really closely here at Public Health. So thank you and look forward to the questions.
Thank you, Dr. Hoffman. Now we'll take questions from reporters. Iridian.
Hi there. I wanted to ask about the youth sports masking requirement. And I wanted to ask why public health masking requirement is differing from the state. So the state is saying that masking is required unless it's a choking hazard, but ours is kind of different. So.
Yeah, thanks. So this was a lot of discussion that happened throughout the months of October and November between both local officials, our local public health jurisdiction, state officials, and currently well, let me back up. So our local changes to allow for in certain circumstances for youth sports to go without a mask came before CDPH made any changes to its statewide recommendations. So we had been having those conversations for over a month before we made those changes, and we had to act, and we felt like it was the longer we waited that it was potentially going to be detrimental to our community. So we went ahead and acted. The following week, CDPH did go ahead and act on the same and came out with nearly the same recommendations. So they took away the choking hazard actually, because what we didn't want to say was, that this is a choking hazard in these circumstances, because then a mask becomes a true hazard. And we don't think that's the case. We can see how in some cases that it might be getting in the way of performance. It could cause, people who are physically exerting themselves at an extreme level, really affecting them, but it wasn't a choking hazard per se. So our language really allowed for the individual to decide, and the leagues and the teams to decide when the mask becomes a hazard. And I think actually, if you read the new CDPH guidance, it's very much in line with what we did locally and what most of the health officers across the state really were hoping for, was that we didn't call it a true choking hazard. We just, kind of said, well, when it seems to be a hazard, you can take it off if you're testing for, to reduce the risk in that environment.
Do you have a follow-up, Iridian?
My only follow-up, I guess, was, would this change, or would the requirement change at all with the variants coming in and out of the county?
I don't think we're planning to change anything right now. The tools we have for this new variant are the same tools that we've had for every single other variant. So, just encourage people to get vaccinated. I think all those folks are eligible. So hopefully many of them are vaccinated. And if they're not vaccinated yet, we strongly encourage them to go out and do so.
Thank you.
That's all my questions. Thanks.
Oh, great. Thank you. Ryan, do you have some questions?
Thank you. I wanted to see, Dr. Hoffman, if you could clarify regarding the percentage needed to drop the masking mandate entirely, if that has shifted from an 80% to more of a 70%, or if there's a gray area there, and why the gray area. And so if we could clarify that goalpost. Thank you.
Yeah, definitely. Great question, Ryan. So the way we wrote those goals in the masking order was to allow for flexibility. We were hoping to be able to get to that 80%, before January 15th. And I think, those of you who are following it, it is unlikely that we will make it before January 15th. But we also knew that very likely by mid-January, if we get there and we haven't seen a hospital surge, and we hopefully will know more about the Omicron variant by then, and who knows, maybe it'll be here by then. We'll know more and we'll be able to make the decision at that point. So it's not 80% is not a requirement to lift the masking mandate. It was a metric that if we met it before the 15th of January, we would lift the masking mandate. So I think changing goalposts are just part of this, and we don't want it any more than anyone else, but unfortunately this is what the virus has given us, is a changing goalpost with every single variant. It's frustrating to all of us, but we're trying to do our best to communicate to the community what that is. And I still think, based on what we're seeing across the state, when you look at some of the counties that have much higher vaccination rates, they're seeing their case rates increase, but their hospitalizations are not going up. And that is really where that's where we want to get to, because we know that the virus is not going to stop circulating. It's going to continue to circulate, probably indefinitely. But when we get to levels of enough community immunity, then we won't see the hospitals get a surge in cases when the virus spikes in the community.
Do you have a follow-up, Brian?
Yes, thank you. And you actually used my favorite term in regard to immunity, the community immunity. So my follow-up would be, how does the community immunity factor into that particular vaccination, goalpost, the 70 to 80% range there, in terms of specifically natural immunity or people with, a previous COVID case? Does that factor in, and to what degree, if so?
Yeah,
when vaccinated?
It's a question that everyone is looking at very closely, and it's not an easy question to answer. So I'll start off by saying we know a lot about vaccine immunity, and we don't know nearly as much about natural immunity or immunity after an infection. What we know about vaccination immunity is that it is strong and it's predictable. The parts that we don't know about, post-infection immunity is it's not nearly as predictable. So there have been studies to look at the amount of immunity in our community in Northern California, and it's surprisingly lower than you would suspect. So while many, we know we have around 10,000 confirmed cases, plus 60,000 plus people who are fully vaccinated, that still leaves a huge number of people in that gray zone, and probably not very many of those folks, even if they think they were previously infected, might not have been, because there were a lot of other colds circulating. And in fact, a surveillance project we've been doing in California since the beginning of the pandemic showed that the majority of colds during the pandemic were not COVID. They were other colds, other cold viruses. So I think, I want to caution not to rely on natural immunity or post-infection immunity because of its inability to be predictable. So we definitely should, that's why we put the goalpost for the vaccination effort. If we get to a place where we see that decoupling of the cases and the hospitalizations before we meet that goal, certainly that we're going to take that into account. But we haven't seen that anywhere, even in places that were hit way harder than us. So I think that what we're going on is based on the science, which is that in communities that have high vaccination rates, they're seeing the decoupling of the hospitalizations from the case rates.
Thank you. Shanila, do you have a question?
I think the question was already asked, but I wanted to ask about potential change of protocols if we do have a case of the Omicron variant here, but I think someone already asked that question.
Okay,
That was really it. Thank you.
you're welcome. Austin, do you have a question?
I do, yes. Thank you so much. I wanted to know, with vaccine eligibility expanding to the 5 to 11 age group, as well as boosters expanding, what is the county doing in terms of meeting the sharp increase in demand and, of course, preventing potential delays?
Yeah, thanks for asking that. So, we've been continuing with our mobile vaccination effort in public health, and we've definitely expanded how many people we can serve in a day at those clinics, recognizing we definitely were seeing more folks showing up to clinics than were anticipated, which is always a great thing to see. So we've adapted to help meet that demand. I think what's also important to note, what's different now versus early on in our vaccine rollout almost a year ago, is that the infrastructure is so much more robust for folks to get a vaccine at our pharmacies, through your medical provider. So, I think I remember seeing some data recently that showed that, most pediatric vaccinations are not happening within public health. It's people going to the pharmacies and their healthcare provider, which is fantastic. That's what we want. This is a healthcare system that we have. It's not public health alone that's providing the vaccine. And so we're seeing that roll out, which is really great.
Do you have a follow-up, Austin?
Thank you so much. I do have one quick follow-up. I was just wondering if you could provide information on where the county currently stands in terms of residents who are fully vaccinated.
I think we're publishing those numbers today in the media report. I don't want to misstate the latest numbers by a percentage point or two, but they are coming out today in the media report. But more or less, I think it always comes down to how you slice it and dice it, right? Is it fully vaccinated? Is it the whole population versus the eligible population? We have been around 60%. I think we're still pretty close to 60% of the total population. When you look at the eligible population, it's a little bit higher. And then when you look at the eligible population with at least one dose, it's significantly higher. I think closer to that 70% mark. So the exact numbers will be out in the press today.
Great, thank you. I'll be sure to look out for that.
Thanks, Austin. Isabella?
Hi, thank you. During Tuesday's Board of Supervisors meeting, several public commenters who questioned the efficacy of the vaccine asserted that local COVID-19 related deaths and hospitalizations were not as significant as public health has made them out to be. Can you speak to that and also explain how death rates for COVID compare with flu deaths in Humboldt County for the last 2 years?
Yeah, thank you. It was striking how some folks were just really painting a picture that's not true. And I think if you ask any of the folks who've been in the hospital over the course of the last 2 years, many of you have reported on what the actual situation is like in the hospital. It's truly sad and heartbreaking what's going on. I think part of it is a misunderstanding of how our healthcare system works. When we put out numbers daily and people don't see these big numbers, they see 1 or 2 hospitalizations each week. They don't understand that those people sit in the hospital for sometimes over 40 days. The average hospital stay for a COVID patient is 28 days. So that's nearly a whole month. That's a huge impact. So if you're getting daily admissions to the hospital, that's what happened back in August and September. And we reached levels of 40 patients in the hospital across the county. And that was completely unsustainable. As far as how it relates to, flu deaths, we haven't had a single flu death throughout this whole pandemic. So I think, part of that is the precautions that we've had for COVID are, very effective against influenza, which is not spread as easily as COVID. COVID spreads easier than influenza, and COVID is much more deadly than influenza. So, I think that if you just think about though, like the impact right now of the number of people we have in the hospital with COVID, today at 19, the other day, around 14, 15, it's been, like I've been saying, around 10 to 15 for several weeks now at a really high plateau. That would be a terrible flu year, like a really terrible flu year. And even to have, 100 deaths, we've never had 100 deaths from flu. I mean, that's a really high number. So, all we can say is that the data is very suggestive, and if you follow the right numbers, you'll see that this is devastating. If you have any questions, talk to anyone who works in the hospital, because they are living through literal hell right now.
Isabella, do you have a follow-up?
I do actually, and thank you so much for touching on that, Dr. Hoffman. And so going back to yesterday's meeting and really truly the egregious misinformation that was being spouted during the supervisor's discussion, it seems like misinformation related to the virus and the vaccine has really only gotten worse. So I guess I would ask, you folks, what is public health doing to try to combat that misinformation? And what is your message to those people?
Thank you, Isabella. I think first and foremost, we as public health through our Joint Information Center are going to continue to provide information to the public that is based on science, that is based on the best evidence that we have to make sure that people have a reliable source of information. So we're going to continue to do that. We have a call center at 707-441-5000. If folks have questions, we have real life people that will answer your phone call and answer your questions about COVID, get you to the best information that we have available. So I think that's really important to let people know that we have that resource. We've had it since the very beginning of this pandemic, and it's a really important resource that we're really proud to offer. The other piece of this, I think, is misinformation. The system that has created the division that we are seeing globally across our country and locally, I mean, the systems that have created this is much bigger than for public health to solve alone, right? So, we are doing our part to get out that information, but it is going to take all of us to share information with our colleagues and with our loved ones, to have conversations. The holidays were around family and friends and loved ones. And so use these opportunities to build bridges with each other. I think we've gotten we've been so isolated in COVID for these protective measures, but I think it's also resulted in making us harder to find commonalities. And how can we have these conversations when we really care about people's safety, people's well-being, and we want people to have access to good information as well. But it's going to take all of us to work towards that effort.
Yeah, and I think Sophia really hit on all the main points. The only other thing I would add would be that it seems to be that at the heart of this misinformation are kind of two main points. One is that COVID is not a dangerous and deadly disease, and I think that's something that we try to get the information out there every day, that it is dangerous, it is deadly, it's affecting our community. And so I think all of us are doing our part to try to keep that message, out there in the community so that people know that the idea that it's somehow just a cold is not true. And then the alternative to the flip side to that is, since it's not a deadly, dangerous disease, the vaccine is not necessary and actually is more dangerous than the disease itself. And I think the data is so clear, and again, that's what we put out data on every day, how much better people are doing who are fully vaccinated. But those are the two main things that they really are driving. And, we just keep putting out information to show that that's not true. And we really try to avoid getting into confrontations with these folks, because we know that that's not going to get us anywhere. So we just put out truthful, factual, science-based information, and we hope that the public and sees that, and they are seeing that because they're getting vaccinated, and our numbers continue to go up.
Thank you both.
Thank you. Iridian, do you have another question? Ryan, do you have another question?
Yes, thank you. Kind of piggybacking on that last question, thinking back to the Board of Supervisors meetings and that they have decided to kind of whittle down the information presented directly, but not the written supply of information. So they're going to get the written reports from you, and correct me if I'm wrong on this, but only having one meeting per month with you directly at the Board of Supervisors meeting. So how do you feel about that? Do you feel like that's not enough, or is it a wait and see with the winter surge? And if you could talk about that.
Yeah, as I said yesterday in the board meeting, it's really, these reports are for the supervisors and to keep them updated in a way that makes sense to them. So the original format of every 2 weeks was something that was decided on very early on in the pandemic. I think I totally understand their reasoning to going to once a month. I mean, they're getting information between those board meetings from myself, from Director Pereira, from other people on the pandemic response. So it's not like they are not informed. So we will continue to update them in that once a month meeting, as well as between. And then I'll say, from a public perspective, we continue to put out a daily press release to all of you that gets out there to the public. So I think we have many forums to interact with the community. We have the Joint Information Center, which is still open, where people can call in Monday through Friday. So we have a lot of ability for the community to get questions answered. I think, having that meeting or having that presentation every 2 weeks, if they feel it is not necessary, it is certainly, the right way to go.
If I could follow up on my follow-up there. So you don't feel like that could negatively impact the publicly available information in terms of, combating the misinformation narratives that are out there? I'm just wondering if that's gonna allow more room for that to grow in absence of those meetings, if you know what I mean.
No, thank you, Ryan. I think it's an important conversation that we need to have in our community around, how can we best get information out to the community? So we're going to continue to get that information out through the JEC, through our daily reports, through these pressers that we're having, through presentations to the Board of Supervisors, and whatever means is possible. So we're going to keep forging ahead and providing whatever information we can in whatever venue that we can.
Thank you. Shanila, do you have a question?
No, I'm fine. I'm here. Thank you.
Austin, do you have another question?
Yeah, I do have one more question. So I see currently Humboldt County is in the red high tier on the CDC's chart. And so I wanted to know, with where we are today, how far away are we, or what's it going to take in order for us to move back down to the next orange substantial tier?
Yeah, so our numbers have been, like we've talked about, sort of plateauing at a kind of higher than we'd like level. And so we've sort of been on the edge between, the red and the orange tier. Today, we're actually a little bit higher even than we were a couple of days ago. We still, would be in the purple tier if we were in the old blueprint metrics. We did dip down for, I think, a couple of days to what would have been the red tier. But what will it take? Those are mostly driven by case counts and percent positivity. And the percent positivity has remained fairly high, and the case counts have also remained, fairly high. So it seems like we're a ways off from any change to that CDC tracker level. I think what it would take would be more vaccination to protect our community and reduce the spread, because we know that people who are fully vaccinated are much less likely to contract the virus, and they're much less likely to spread the virus if they do contract it. And then they also, as we know, are much less likely to become hospitalized and take up a hospital bed if they contract the virus.
Great, thank you so much.
Isabella, do you have another question?
Yeah, I do. I'd like to go back to vaccinations for kids. So it's been more than 5 weeks since 5 to 11-year-olds were given the okay to get vaccines. I think you may have touched on this, but I might have missed it. What percentage of kids in this county are fully and partially vaccinated? And also, how does that compare with the first 5 weeks for other age groups that previously opened locally?
So the numbers are changing daily. The last time I checked, we were above 20% with at least one shot. And it's only been, a week or two that those first round of kids would have been able to get their second shot. So I think we were around 10% of those who had gotten a second shot. So, we're expecting that probably the vast majority of the first, the people who rushed out and got it right away are going to go ahead and get their second shot. So I would assume that over the next couple of weeks, you'll see those numbers fill in to close to 20% of our 5 to 11-year-olds fully vaccinated. How it compares to other age groups, certainly is a difficult discussion, because when we opened up, to a lot of the other age groups, we didn't have very much vaccine. So, there wasn't the clear lack of appointments and lack of vaccine for that age group. I certainly would expect it's going to be slower though than other age groups. And so we're just, trying to continue to work with partners, local pediatricians, with our local healthcare system, to get the word out that the vaccines are safe and effective for kids and are necessary, and will have an impact on this pandemic by vaccinating our 5 to 11-year-olds. And we have continued to make progress in the older kids age group too. The 11 to 17-year-olds have continued to increase over the course of this school year. I think as probably many families see exposures in the classroom and how that impacts their need to quarantine, have probably made the decision to just go ahead and vaccinate, so that they don't have to quarantine and that they can protect their families from the coronavirus.
Isabella, do you have a last follow-up?
Yeah, just real quick, and this is sort of anecdotal. I'm not really sure how much you can speak to it, but I'm wondering if there is maybe more resistance in getting kids, maybe the younger the kid, the more resistance, I don't know, but more resistance in getting kids vaccinated, because I've heard from several people that, oh, I have my vaccine, but I'm not getting it for my kids. No way. Is that something that that you're seeing?
Oh yeah, there's no question. There's national data on this, that this 5 to 11-year-old group is the most hesitant of all the age groups. The Kaiser Family Foundation did a poll and found about 30% of all American families were definitely going to vaccinate their 5 to 11-year-olds. So, the fact that we're up to over 20%, I think we were close to 23% with at least one shot within, the first few weeks of opening up is, I think, really good. We were above the state median for vaccination in this group. And we're going to continue to work on it. I think it's certainly, I understand, I've worked with families my whole career on this, and something that, people struggle with as parents. I think all we can do as physicians and pediatricians in the community is listen to the concerns and try to get good information to families to make the decision for them. Obviously from a public health perspective, I really strongly encourage everyone to go ahead. But I think anyone who's having concerns or questions should go talk to their pediatrician about this, and find out that, yeah, there are benefits. I'll just point to one example. If we look at childhood diseases that we require vaccination for, things like hepatitis, things like measles, chicken pox, these are things that that in the last 10 years have not killed nearly as many kids as COVID has in the last 2 years since this since this whole pandemic began. So the idea that again, just going back to those premises that COVID's not bad, it's not a deadly disease, and therefore we don't need to vaccinate against it, there's just such clear data on that that's not the case. So we know that it will protect against death in this age group. And even though death is very rare in this age group, it's not unheard of, and it's easy to prevent. And then it affords all the protections to keep the schools open, to keep kids in school, to not have to quarantine them, to move us towards a day and time when we can treat COVID as another disease that we deal with on a day-to-day basis, like it is another cold, like it is just the flu. We don't do all of this for those because they don't have the tremendous societal impacts that COVID-19 has had on our communities. And so the higher our vaccination rates, the closer we are to, having that normalcy with COVID-19.
Thank you.
Thank you all. That's all the time we have. Thanks to our panelists and to our media representatives for joining us today. We will send links to the recording as soon as we have them, and have a great day.